Stretch marks are a very common problem for both men and women. Initially, only women were worried about stretch marks, but nowadays I'm seeing a lot of men who are actually worried about stretch marks. Now, what are stretch marks? It's as simple as the term states, a stretch in the skin which causes a breakdown of collagen and elastin fibers in the skin, because of which the skin has some amount of scars which are evident. Now, what are the common areas where we see stretch marks? On the arms, shoulders, on the breast, on the thighs, on the buttock area, on the back of the knee, and one most important area is on the tummy or abdomen. Sometimes these stretch marks also progress to the back, lower back, and mainly these stretch marks are seen in 4 common conditions. Obesity, someone who is rapidly increasing the weight, and during pregnancy usually like women gain a lot of weight and there is a lot of stretch of the skin, because of which we see the stretch marks. Puberty is again very common, because in the puberty age usually we see there are hormonal changes which are happening, because of this that skin quality changes, and you see stretch marks mainly on the thighs and back of the knee and on the arms. And the 4th thing is someone who is into bodybuilding also have like a lot of intake of the proteins, and like they try to bulk up, and because of which they can have some amount of stretch marks. There is one more aspect to the stretch marks, that is someone who is upon the medication. There are few tablets which can actually cause stretch marks in the long run, but these tablets might be essential for that particular concern they have. Yes, but there is a possibility that you can get stretch marks or weight gain because of this. So it's a subcategory of obesity itself. So these are the common causes where we see the stretch marks. Now, what do I do to prevent? In most of the skin conditions, prevention is better than cure. So when you're actually starting to notice the stretch marks, it's better to apply a moisturizer on a very regular basis. A very thick moisturizer, when you apply it on all the areas of the skin, this helps in prevention of the stretch marks. Also, it gives some good support to the skin layers so that the breakdown of the collagen and elastin is not as bad when you compare with others. A healthy weight gain and also a healthy weight loss is very essential when we are talking about stretch marks, because someone who is rapidly increasing weight and also rapidly reducing weight will have equally like negative effects. Like when you are increasing the weight rapidly, there is an appearance of stretch marks, and again when you're losing rapidly, there is a lot of sag and there is a lot of stretch mark appearance. So go it in a healthy manner so that the weight increase or weight decrease happens on a regulated manner. And also when you're trying to put on weight, try with natural ingredients rather than artificially available products. One important thing when it comes to the stages of stretch mark are, initially you might notice some amount of itching over the stretch mark area, but this is again very important. You should not scratch on those areas, because these can lead to a permanent mark sort of. The second thing is, there are a lot of people who notice brownish or reddish spots, like linear stripes or lines sort of on the areas where stretch marks might appear. Now this is nothing but the second stage of stretch marks, wherein it is reddish to brownish color, but this is the best phase for you to treat them. The last thing is, like, the stretch marks are already white or skin color. So this is the last stage wherein the stretch marks have already formed. It's not in the process, but it's already formed. Now to control this, or like to take care of this, we need to go ahead with some kind of treatments and all. What is the treatment for the stretch marks? Initially, to prevent, as we discussed, no scratching and apply tons of moisturizer. Also a healthy weight gain, healthy weight loss are all essential in the prevention phase. When it comes to the proper treatment, we do try it out with topical creams. So we do give creams to apply on a regular basis. Now these creams give some strength, also trigger some amount of collagen, alter the texture of your skin to make the appearance of the skin look better. 5 to 10% of the result will be with the help of these creams. And when you have red or brown color stretch marks, definitely these creams can help you out to an extent of 50 to 60%. But when it is already whitish in color, as we already discussed, 5 to 10% is the change, but it definitely gives you a good quality of the skin. When your stretch marks are already white, these are your options for the treatment. Apart from the creams which mandatory you have to use, there are certain procedures which we do in clinic which can benefit and give you some good boost of collagen. So when we are talking about like white color stretch marks, what happens is, apart from the stretch marks, you see the flabbiness of the skin. The skin is not tight. So these procedures help in overall appearance of the stretch marks to be much better in terms of the width and length. For example, if your stretch marks are this thick and this much length, so when we do this procedures, at the end of the process, we do expect you to see a change of somewhere around the width becomes like less than 50% of before, and the length also reduces by a great extent. But with the 6 sessions usually of the lasers, when we advise, this is the result what you can expect. But the flabbiness is reduced to a great extent. You'll see some tightening of the skin, and you will also see the quality of the skin is much better. Someone who is actually like, further wishing to reduce the stretch marks even beyond that, then they can continue the sessions further. Let's see the options for your stretch marks. Fractional CO2 is a great option. At least 4 to 6 sessions of your fractional CO2 laser will induce a lot of collagen on your skin where you have stretch marks, reduces the length and width. The 3-dimensional form of stretch marks reduces greatly with fractional CO2. Microneedling radio frequency is again one more important laser what we have of late. Microneedling radio frequency is triggering the collagen from beneath. Also, it gives you good amount of tightening. Most of the times we do combine fractional CO2 with microneedling radio frequency depending on the stage of the stretch mark and also depending on the area of involvement also. There is platelet rich plasma. I'm sure platelet rich plasma you have seen, which is very beneficial for a lot of things. Again, in the stretch marks, to improve the quality of the skin, we add on platelet rich plasma along with the existing fractional CO2 and microneedling radio frequency. And there is also derma roller, but this is a very age-old technique which we are no more following. At the end of all your sessions, if you have some issue with the flabbiness or still like you need some improvement in the tightness of the skin, then you can consider high intensity focus ultrasound to give you that amount of tightening and to give a overall wonderful look on the skin. If you have more questions about stretch marks, please do drop a comment.